Then, Chapter 5, Psychological Interventions for People Exposed to Disaster. Exposed to disaster. So, these principles provide general guidance for clinicians to address mental health effects of disasters. The first guiding principle of disaster of mental health is that people are resilient. So first of people are resilient in efforts to identify mental health problems to be addressed. It is easy to develop. It is easy to overlook the resilience of the majority who do not develop psychiatric disorders. The second is distress is normative. Clarifies that even though most people do not develop psychiatric illness after exposure to disaster, trauma was people will experience at least some emotional distress. Thus, emotional distress after exposure. The disaster is normative and a normal response, intrusive memories, and hyperarousals. Symptoms are particularly common manifestation of emotional response to disaster distress. So, paradoxes in psychological assistance in disasters. So, the pathogenic character of disruptive situation lies in the situation itself, external to individual more than his/her biological or physiological condition. So, why are mental health professionals necessary during disasters? So, mental health and psychosocial relief uh, efforts should be an integral part of disaster preparedness plan. So, the best levels of disaster preparedness can be achieved having a strong community mental health system in place which can be rapidly scaled up to meet the needs of the affected people in case of disaster. So next is what is our objective while assisting during disaster. So in collapsing environment, endangered or harmed psychological processing abilities are the core of our interventions. There are two concepts to be stressed. Uh, uh, A, the recovery of the individual subjectively, then B, the maintenance of ability to elaborate the inner-outer world relation. Therapists should be finely tuned to be with the timing, place, and manner of the intervention and highly sensitive to cultural characteristics. Then fourth, who must intervene to ensure people's psychological stability. So, as a ratio between variable practitioners and people in need of mental care is to inadequate a population as a whole must become a resource. Mental health professionals play an important role in acknowledging people's ability to assume responsibility. So next is 5. Whom are we going to assist? During disasters, mental health care is usually given to those showing their needs in the most evident way. Yet, we need to be sensitive in order to identify those who remain silent, a part of make believe that nothing happened to them. So, some groups are especially targets children, in elderly, pregnant women, disabled people, and those at risk due to psychological weakness and lesser capacity to deal the traits with traits. Whose do we have to intervene? So this question concerns individuals and social institutions in two different aspects. First is the mere presence makes human beings subjectively respond, even though we may have no relation at all with the occurrence of external facts. We still are inevitably are responsible for our reaction to them. So we as communities have mass institutions which are accountable socially and legally for disaster. That is not only who guilty but who is in charge to the ministering assistance. Next is when do we have to intervene? So intervention during disaster involves four different stages. First is the pre-impact phase, in which action is directed towards building mental immunity in all members of the community so that they will become capable of recognizing the nature and importance of the menace, organizing available resources and acting properly and according to the circumstances. B is the impact phase, in which actions are directed to evaluate the impact of event on the population and to respond the urgent and acute needs. Then third, the phase immediate after the occurrence of the event, in which actions are directed to evaluate individual responses to prevent the development of pathogenic mechanism and to respond the emerging pathology. So D, the long-term phase, in which actions are directed to provide treatment to people that need long-term assistance to cases of late appearance of mental disturbances, and in which strategies for building a mental immunity should be reinforced as a preventive measure of the future. Then, where do we have to intervene? So, mental health professionals will often need to be flexible and create adequate therapeutic milieux, even if completely inadequate environments. Any places can become a suitable one of the therapy if it is signified as such. For example, in the open by underlining the sheltering character of a tree, uh, we have called this process from the couch to the stone. So number 9 is in which ways are we going to intervene? So treatment can consist of individual, family, or group interventions. Professionals must stick to the core of their theoretical frameworks while adapting techniques to the circumstances. The next is wholesale. 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 Wholeness means an integrative approach based on the previous 9 W's on a consistent vision of the problem, the ways to intervene, and the organization of assistance. The completely of disaster requires not only the integration of psychiatric and psychological aspects, but also knowledge about social, political, economic, and cultural processes. This not this does not mean that we will take care of all aspects of the problem. On the contrary, we must restrict our intervention to our specific role, preserving the ethical values of professionals. Cognitive cognitive behavioral intervention are rooted in the learning theories as classified conditioning operant avoidance. So cognitive behavior intervention is a process by which patients learn to become expert of their own behavior through cognitive behavioral intervention, or patient learning to examine their thoughts, recognize when negative thoughts are increasing, and then apply the number of strategies to alter those negative thoughts and emotions. Next is eye movement desensitization and processing. So, processing. Sometimes PTSD can start right away after something happens, and other times it takes a while to notice symptoms. So, when a person has PTSD, is usually means that painful memories become a problem in a person's life, and that's when someone might need some help. So, like EMDR, or eye movement desensitization and processing, is an evidence-based treatment, which means it's been proven to be effective more often than most other types of therapy. Somatic awareness approaches. So, approaches are used to engage the relationship between mind, body, and the behavior. Somatically trained therapists use interventions to help calm this client's nervous system and create more ease in the healing process. So that's the somatic awareness approaches. So psychoanalytically oriented psychotherapy. So psychoanalytic therapy is a form of psychotherapy that seeks to help people by helping them to understand themselves and their experiences. It is based on the notion that, as well as our conscious ideas and feelings, we are motivated by ideas and feelings of which we are not consciously aware. So that's all. Thank you.